Thank you very much for this opportunity to come and meet with you all for some training. Today we're going to focus on upper extremity. But first, before I get started, I want to give you a brief history on medi. We have been specializing compression for over 60 years. We are specialized in both ready-to-wear and custom compression garments for the treatment of lymphedema and wound care. And we specialize in circle knit and flat knit garments, as well as Velcro and elastic garments. Today we'll talk a little bit about our ready-to-wear circle knit and flat knit garments, as well as for upper extremity, and then our Velcro and elastic custom garments for upper extremity. Many times the referrals that you're going to get at most of the government installations are probably going to be ready-to-wear. You've got family doctors, you've got lymphedema therapists, you've got vascular, as well as cancer centers prescribing garments for both palliative care, mild swelling, as well as treatments for post-breast cancer surgery, post-mastectomy. They're going to need arm sleeves and gloves to manage any type of swelling. Also, minor injuries or post-burns or burn garments. Our garments work well for that as well. So there's a variety of reasons why compression garments are going to be prescribed, but the main reason is going to be just either for mild swelling and edema, as well as other more serious indications of lymphedema or wound care. And we'll get into that later as we go on about the garments. We'll focus on upper extremity today, and then on the next training we'll go over lower extremity. So for one of the main reasons that you're going to get your patients and our active duty coming in for compression garments is lymphedema. In the brochure I have here, this is going to talk about I hand this out to a lot of therapists as well as physicians throughout who need to go over the different stages of lymphedema with their patients. There are 3 different stages of lymphedema. And it's important for you to know because the prescriptions are often going to come through with this on there, or when talking to the patients who come in, you need to ask them a little bit about their stage if you're going to get a little more history from them that they're getting from their clinician. So stage 0 in the first image is the lymphatic vessels are already damaged, but there is not yet any visible swelling.